And I think this is something that not a lot of PTs will talk about. And I wanted to be real with you guys because you guys know how passionate I am for the field of physical therapy, for fitness and all of that. And yet, 4 freaking months in, after I worked so hard to work for this doctorate degree, I'm feeling burnt out. Hello everyone, we are back at it again with the weekly vlog of what's been going on here in my physical therapy clinic right up there in that medical building. For those of you who are just joining in on this vlog, hello, my name is Justin Lee, physical therapist here in Hawaii. I am an entry-level physical therapist, just graduated December last year, and I've been working for maybe like 6 months now. And if you're watching this vlog, you're probably wondering like, what the hell is life as an entry-level PT? Well, I'm gonna tell you, all right? Let me tell you a little what I've been noticing here so far while I've been working. This is gonna be a short video. But I've been noticing, I've been working for about 6 months. And now as I've been kind of getting more comfortable with my practice and getting more understanding of what's going on as my role as a PT, I am starting to learn and start to feel that I am getting better. I'm getting proficient. I am being able to recognize similar patterns of patients that are coming in that come with knee injuries, shoulder injuries, back injuries, and know like exactly like bam, 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 what exercises, what treatment I'm gonna be doing probably within the first 10 minutes of talking to them already, which is great, you know, that's awesome. So then it opens my mental capacity to think and to think about what I want to do next, to be able to relate with the patient a lot more, to connect with them a lot more. I'm noticing that that part of my life has been getting good. And I also want to tell you about something else. So maybe about 4 months in, after I started getting comfortable, I was getting good. I'm like, all right, I'm knowing what I'm doing. And then I started to plateau and actually felt like my drive, my fire started to go down. And this was during the time when I was like feeling a lot of burnout. Like, oh my gosh, same patients, more patients, clock in, clock out, do the same thing over and over. And I'm like, why the hell am I doing this profession? Like, can you believe it? Like 4 months in, I'm already thinking about, man, I'm feeling burnt out. Is this what I'm gonna be doing for the rest of my life? And I think this is something that not a lot of PTs will talk about. And I wanted to be real with you guys because you guys know how passionate I am for the field of physical therapy, for fitness and all of that. And yet, 4 freaking months in, after I worked so hard to work for this doctorate degree, I'm feeling burnt out. Like, what the hell, you know? And I'm gonna tell you what I did to get away from the burnout in 4 months and to start burning in and having passion for my patients all over again. And this is what I did. During the time when I was feeling burnt out, about 4 months in, I started realizing that I started seeing patients as just like patients where I would just do my job, do my thing, and then leave. That was it. They were just people that I needed to go in, treat, document, say what I needed to say, and then bounce. And then I realized, I'm like, what's going on? Like, why am I feeling burnt out? And I realized that my behaviors were were having the perspective of seeing the patient like that. Like as if like they were just a part of my job and that's it. And when people say, oh, like you did so good, whatever. And then people say, oh, I'm just doing my job. I don't think that's right, because if you were just doing your job, then you just go in, clock out, and you just get your paycheck. But if people, I think you should start saying, yeah, well, I'm being intentional with you, you know, like, yes, like my job is to treat you and whatnot, but the job does not entail going above and beyond to relate and create relationships with your patients. And boom, right there, that is the moneymaker. That was the difference between getting myself from burning out and burning in for my patients. It was the ability to have the perspective of going into each treatment session, knowing that I wanted to connect with the patient, knowing that I wanted to make a lasting impression and just make a relationship of friendship from soul to Korea, Seoul, Korea. Just kidding. But soul to soul, you know? Like when I started making that connection from soul to soul and person to person and asking them, hey man, so how are your kids? You told me that you were gonna have a birthday party last week. How did that go? Or hey, you're going through a lot with your family. You're going through a lot with some drug abuse, some family abuse. What's going on? You know, tell me, I wanna know. And it's that transparency that is created from the patient to me, and me receiving that transparency and that information, and just being a listening ear, just being empathetic, just being caring, compassionate, has made all the difference. All the difference. Everyone in these cars are looking at me right now like I'm crazy. But that's the lesson for this week. Honestly, I didn't think that I was going to be burnt out after 4 months, but I just really wanted to think about how I wanted to word this, and yeah, that was it. From burnout to burning in with your patients, it's all about the connection, the relationships, and all that. If this is something that you relate with, or you're like, hey, that makes a lot of sense, I want to know in the comments if you were burnt out at some point. If you're a PT or maybe you're a student and you're burnt out, what did you do to get from burning out to burning in for your patients all over again? Let me know. I want to hear it. Let's start some discussions, y'all. Put it in the comments. Thanks everyone for this weekly vlog and for tuning in. Stay lifting, stay aloha. Have a great one, you guys.